We've also got to think about red flags that are orthopedic manifestations like biceps tendon rupture, carpal tunnel syndrome, lumbar canal stenosis. And that combined with heart failure is a really big alarm bell for me that this might be an ATTR cardiomyopathy. Only about 6 years ago, we didn't have treatment. The space has rapidly changed. And so a big challenge is raising awareness that we have this disease-modifying therapy. A lot of general practitioners in their clinical career might not have had this disease-modifying therapy, and therefore our awareness is low. That our diagnosis of amyloidosis is very much the tip of the iceberg. There is a lot that we are missing. And so I think a big challenge is being able to increase awareness and increase education. The other big challenge is being able to get patients to multidisciplinary centres of excellence because of wait lists, because now we've got a lot more patients being diagnosed, which is a good thing, but streamlining those services and then getting patients access to treatment, because a lot of the drug therapy is incredibly expensive. We've got to raise awareness at the level of the medical student, at the level of the nursing student, up to primary care doctors, general physicians, internists, cardiologists, and then specialist cardiologists. Patients see 5 specialists before they get a diagnosis of amyloidosis. And when you think the time, the effort, the distress, the cost of seeing a specialist to then not have an accurate diagnosis, especially when you have a disease that we know is rapidly progressive without treatment, it's hard to think about, but we do know that there are huge delays. It's a big unmet need, that there are huge delays to diagnosis. So why is that? Well, I think first of all, awareness. Second of all, education. 10 years before diagnosis of cardiac amyloidosis, you might have a diagnosis of carpal tunnel syndrome. Now, if we were to send off every biopsy of everyone with carpal tunnel syndrome, what does that give us in terms of follow-up? We haven't done that to a good enough degree yet. But I think there are a number of ways that we can diagnose early if we increase awareness. So, we don't typically think orthopedic or we don't typically think carpal tunnel syndrome when we think about other heart failure conditions, but that is a fabulous red flag at the primary care level to be able to say, okay, maybe I need to do more screening, or maybe I need to follow this patient. And I think there's a lot of evolving space about early disease. We know that, now that we've got good therapy, the earlier you treat a patient, the better their outcomes. But we still don't know exactly what early disease looks like. My closing remark is 3 words: awareness, awareness, awareness.